eyelid inflammation, blepharitis, dry eye, ocular rosacea. These are common disorders that are often overlooked or underdiagnosed. And I think the reason for that is we really haven't had good treatment options until recently.
I would say that we haven't had the technology to determine eyelid disease and its extent in the individual patients. And Cliradex has changed that dynamic for us.
Cliradex is a completely different treatment method. In the past, we would use warmth, we would use antibiotics, we would use lid scrubs. We didn't really have a therapeutic option. We had options that would clean up the mess, but we didn't have an option that would get to the heart of the problem.
With traditional treatments, we were just treating the crustiness on the eyelashes. We didn't know that there was actually little mites that live at the base of the eyelashes.
With Cliradex, we've got an option that gives us the heart of the problem and makes the treatment much quicker and more effective.
So what Cliradex has done is it takes the most active ingredient of tea tree oil, and that is what actually is helping people with their chronic eyelid disorders.
Cliradex is a purified form of tea tree oil. We use it on the eyelids to kill the mites. One of the problems with routine use of tea tree oil is it's quite toxic and irritating. So you can kill the mites, but the lid's not happy either. So Cliradex is a purified form of the active ingredient. So when we use Cliradex, we get an effective clearing of the mites, but you don't get the secondary irritation. So it's a much more effective way to use the tea tree oil.
Patient response to Cliradex has been incredible, as normally we will fight the disease for 3, 4, or 5 months. With Cliradex, we are getting immediate results within 3 or 4 days normally.
In my patients with ocular rosacea or blepharitis, I confidently recommend Cliradex and expect excellent results.
I would call Cliradex the next generation of eyelid treatment because it works. It gets rid of the Demodex and not only works on blepharitis, but also works on acne rosacea. It's a product that works. I'm very excited about that.
Cliradex has already changed how I practice and how I treat my patients. And excuse the pun, but it's changed the way I look at my patients as well.
Our goal always is to get to the core of the problem and not just treat the surface layers of the problem. When that opportunity comes and when that opportunity is presented to us doctors, it's quite exciting and can cause quite a paradigm shift in the way we treat our patients. Cliradex offers that type of paradigm shift.
It has changed my scope of practice from the simple fact that I know that I can treat something easily, efficiently, and the patients are very happy.
When a doc says, hey, we couldn't solve the problem before, we can now, presuming that you make the correct diagnosis, that's a huge deal. There's very few things in medicine you can say that about.
So it's really exciting to be able to, with enthusiasm, tell my patients that there is a wonderful treatment option available to them.
You're crazy if you don't look into this product for your practice. That's how good Cliradex is.